2025 Covered California income tables have arrived. Hello, I am Kevin Knaus, an independent health insurance agent and also a certified health insurance agent with Covered California. And for the 2025 open enrollment period, Covered California has released the latest income table for the different programs that they administer. And the income table is just a lot of information on there. It's very busy. And so I wanted to go through and kind of explain how to read some of this stuff, because some programs may apply to you and others may not. So, looking at the income table, if you go to the very left-hand side, it'll say household size, and that applies to the rows 1 through 8 there. Your household size is your federal income tax household. So, whoever you put on your federal income tax return, if you have a spouse, you have children, that constitutes your household size. It doesn't include anyone that's renting or if grandma lives with you. It's the people that are on your tax return. So if it is you, your spouse, and 2 children, that would be a household size of 4. And so you would go to that row and then go across. Now, one of the columns is marked 100%. That is 100% of the federal poverty level for 2024. They use the 2024 federal poverty level to then, they increase those, for the different programs that they have. Now, that federal poverty level will change in 2025. And Covered California will issue a new income table, and that's what creates a lot of confusion. But when the federal poverty level goes up for 2025, it will only affect those programs that are pertain to Medi-Cal. So if we look across the top there, you can see a lot of different banners and things going across, and some of the stuff on the top corresponds to some of the banners on the bottom. I'm going to focus on the yellow-orange California poppy color columns. So 138%, that is 138% of the federal poverty level for the income. So they just take whatever that number is, for the household size, multiply it times 1.38, and that is the number. If your annual income or monthly, when we're dealing with Medi-Cal, is below 138% of the federal poverty level, you are eligible for Medi-Cal. The next column is 213%, and that is Medi-Cal for pregnant individuals. So a woman indicates that she's pregnant on the Covered California application, she would be offered Medi-Cal and not the subsidy. And then 266%, that's very important for many families. If the household income is below 266% of the federal poverty level, children that are 18 years old and younger are eligible for Medi-Cal, while the adults may be eligible for the subsidies with a private health plan. And then 322 is the C-CHIP program, expanded children's Medi-Cal in the counties of San Francisco, San Mateo, and Santa Clara. So families in those counties can have a higher income and still have their children receive no-cost Medi-Cal coverage. Now, also across there, you'll see right above the different percentages, there is the Silver 94, Silver 87, Silver 73. So if the household income for an adult is between 138 and 150% of the federal poverty level, they will be offered a Silver 94 plan. And a Silver 94 is very good. It's better than Platinum. It has very low co-pays, maximum out of pocket, reduced cost sharing. If the income is between 150 and 200%, they are offered a Silver 87. Not as good as a Silver 94, but still lower co-pays. And then you'll see Silver 73 from 200% on out. Now, Silver 73 last year, or 2024, stopped at 250%. You'll notice there is no Silver 70 on here. So if you're in Covered California and you're offered a silver plan, it's going to be a Silver 73, which is enhanced, lower copays, no medical deductible, and a lower maximum out of pocket than a Silver 70. And that is a result of some different legislation and some changes within the state of California to help people out. So if you are above 200% of the federal poverty level and there is that Silver 73, strongly really look at it. I'll do another video on some of the differences, but it's a good deal. Now, across the very top, in that blue line, it talks about the federal subsidies, and it says the tax credit continues beyond 400%. So, for many years, the subsidies stopped for any household income that was over 400%. And when you did your taxes, if you were over 400%, you had to pay back all the subsidies. That changed in 2021 with the Inflation Reduction Act. Okay, so now you can earn more than 400%, receive a subsidy, not have to pay it all back. Because the subsidies, the formula for that is based on your income, and now you can make more than 400%, which many people do in California. And the benchmark plan for calculating the subsidies is the second lowest cost silver plan, SLCSP. So that is the key. That's the benchmark. And if the household income is over 400% of the federal poverty level, the way the ACA reads is that you should be paying no more than 8.5% for the second lowest cost silver plan. So that 8.5% is the consumer responsibility. So let's look at an example. Single adult, age 60, Northern California, because the rates are really expensive up here, an income of $100,000. That's way over 400% of the federal poverty level. The consumer fair share, 8.5%, or $8,500 of $100,000. Now, the second lowest cost silver plan annual premium, and I pulled this right from the Covered California. This isn't a made up number. Is $18,252 annually. So we take that $18,252 minus the consumer's fair share of $8,500. That equals $9,752. Covered California takes that $9,752, divides it by 12 months, and that individual who is 60 years old in Northern California is eligible for $813 per month to lower their health insurance premiums. They can apply it to any metal tier, bronze, silver, gold, platinum that they want. They can apply it to any health plan they want. Kaiser, Blue Shield, Blue Cross, whatever, whoever's that, they can apply it, but that's what they are eligible for. Now, this particular chart down below kind of shows how that consumer responsibility percentage, the curve of it. So if the household income in California is between 138 and 150% of the federal poverty level, the consumer responsibility percentage is 0. That means the subsidy is equal to the second lowest cost silver plan. So if someone selects a second lowest cost silver plan and their income is, let's say, 145% of the federal poverty level, it will be 0. The lowest cost silver plan will be 0. Many bronze plans may be 0. There may be some gold plans that are 0. It all depends on where you live and the plans that are being offered. But of course, you can take that and apply that to any plan. And then you can see as the household income as a percentage of the federal poverty level goes up, the consumer responsibility also goes up. Because it's on a curve. So anything over 400%, the consumer responsibility is 8.5%. And then if the income goes up so high that the second lowest cost silver plan is less than 8.5%, that is when there is no subsidy. So let's look at a couple examples. Household of 2, one adult one child, income $40,880. The adult, because the income is over 138% of the federal poverty level, will be offered a Silver 87 with a subsidy. The child, because the income is below 266%, will be Medi-Cal. They can't get a private plan with a subsidy. Household of 4, you come over there, you go down to row 4, and then you go across. 3 adults, 1 child, an income of $40,800. Well, that's below 138% for the household size. Everyone is Medi-Cal, 0 cost. Next example would be household of 4, 1 adult, 3 children, an income of $85,000. So you go down to row 4, then you go across, and sometimes it's not exact, but we know that it's more than 266%, less than 300%. But because the income is over 266% of the federal poverty level, the adult and the children are eligible for the subsidies through Covered California for a private health insurance plan. And then you'll see down below, I kind of highlighted a couple of those in a green box, because if a person indicates they are pregnant within the household, they could get Medi-Cal assistance, either full Medi-Cal if the income is below 213%, or they could get the Medi-Cal Access Program, which helps with covering some of the costs of pregnancy. So that's in there as well. So there's a lot of information that's going on in these the income tables and how to read them. So hopefully that kind of helps. If you have any questions, you may leave comments down below and I will do my best to answer them. If you have any suggestions for other educational videos on this Covered California stuff and income and health plans, let me know down below and I will work to put something together. Otherwise, for InsureMeKevin.com, I'm Kevin Knaus.